Well, we have been dealing with COVID-19 for over 2 years now, and despite the numerous calls for people to get vaccinated, we are still dealing with COVID-19 hesitancy. The question is why? And another question is, why exactly do we need to get vaccinated? Well, you will find that out on today's conversation. So welcome to the show. My name is Winnie Lubembe, and we're coming to you from 4 Points by Sheraton. So we'll be delving into the COVID-19 vaccination conversation after this fact of the matter. Vaccines reduce risks of getting a disease by working with the body's natural defenses to build protection. Since the onset of COVID-19, several vaccines have been approved by the World Health Organization for use, and by the end of 2021, nearly all countries had introduced COVID-19 vaccination. To date, 4.86 billion people have been vaccinated globally, while Kenya has vaccinated 8.9 million people. Well, the biggest question has always been, why do I need the vaccine? Well, you want to stick around until the end of the conversation. You'll understand why a vaccine is very important, especially now that we're talking about COVID-19 vaccine, why you exactly need to get vaccinated. But to help us with the conversation, I am joined by Dr. Willis Akwale, who is the chairman, National COVID-19 Vaccines Task Force. How are you doing today, Dr.?
We're fine, we're fine.
You're fine. Karibu sana. And of course, we also have Dr. Kibet Sergon, who is an immunization advisor at the World Health Organization. How are you doing today?
Very well,
Very well. Karibu sana to the show. And Dr. Willis, let me just start with you. COVID-19 vaccine. We have sung this song over and over and over again. So how are we doing as a country? How many people have we vaccinated? And of course, the projections.
So let me say that now it's almost 1.5 years since we started vaccinating against COVID-19. We've had some fairly very good progress. We have had challenges that we kept surmounting. I think the very first thing we did was to get Kenyans to accept the importance of COVID-19 vaccines, the need for them to have, and that was in March last year. At the peak of this pandemic, when the number of cases, the admissions, we had just started the fourth wave, and everybody could see things are not good. But you know, we then had the global challenge. The vaccines were not readily available. But then towards the mid of last year, August and September, we started getting adequate vaccines. And up to now, that is not a challenge. However, especially from February of this year, the uptake has not been good. We used to do almost 200,000 vaccinations a day around January, February. But now we are hardly doing 20,000. So in terms of our targets, by end of June, which was just a few weeks back, or 2 weeks back, we had anticipated to vaccinate 19 million adults, fully vaccinate. But we've just done about 8.8 million, so below 50%.
Then Dr. Kibet, just to remind people on how important vaccines are, and now that, again, with this season, COVID-19 is here with us, why do people really need the vaccine?
Vaccines have been proven to be one of the most cost-effective tools that we have in public health, apart from clean water and good sanitation. And therefore, for people to get the COVID vaccinations, it will confer them immunity and protection, such that if one has the bad luck of getting the disease, then they at least have a primed immunity that will ensure that they do not get a severe course of disease, and the likelihood of dying from that disease is reduced dramatically.
And of course, we understand the safety issue, which again, Dr. Akwale has mentioned, but the question of then who needs to go and get vaccinated?
To drill down to the Kenyan context, currently the recommendation is that anybody above 12 years of age should get the vaccinations for all categories of people. But the emphasis should also be taken into account that we need those people who are at most risk of getting severe disease and dying to be protected. And these are people who are elderly, people who have underlying disease conditions that predisposes them to getting severe form of disease, like people who have hypertension, diabetes, people with cancers, people who have sickle cell disease. These are people who are at more risk of dying from the disease or getting severe course of disease if they get infected. So we encourage everybody to get their vaccinations because that would protect the entire population going forward. Of course, there are also people who are in special settings, like refugees, people in prisons, and also people who interact with several number of people, like ports of entry. So you need to be able to get your vaccines, but more importantly, also observe the other public health measures.
And Dr. Akwale, then children below 12 years, what's going to happen to them? How soon should we expect to see them get vaccinated as well?
The fact that they're not being vaccinated now does not mean that the vaccines do not work for them. It's just that the data, the safety data, has not been presented for evaluation to get that regulatory approval for use. For us, our technical immunization group, which met in June, recommended 12 years and above based on the data that they were able to evaluate from international agencies. When you are considering herd immunity, which is one of our goals, you then realize there's a big cohort of children who are not going to be vaccinated. And that is why the reason we need many of those who are eligible to get vaccinated, because that's how you reach the 70%.
And are there plans maybe to roll this, especially in the country, maybe anytime soon?
Currently, remember until 2 or 3 weeks ago, we were vaccinating the teenagers who are 15, 17 years. Now we are bringing 12 to 15, and that's a very big cohort. So one of the issues with persons below 18 years is the issue of consenting, which can be a challenge because that is required by law. And we started realizing that consenting within medical institutions is easy. But when you are doing outreaches and going to schools, proof of consent can be a challenge. And that is why currently the courts have instructed that until we come with a good system that will prove consent, especially in schools, we are not vaccinating outside medical institutions.
And then, of course, WHO has really been at the forefront in terms of trying to fight dis and misinformation, which is out there, and especially when it comes to fertility, which Dr. Akwale has alluded to. So then, when it comes to tackling this and making sure that the right information is there as far as COVID-19 vaccines, what are some of the measures that WHO is implementing?
Well, that's a big one. Because there's no straight arrow that you can shoot and say you're going to aim and get it. It's a multiple approach that has to be employed to ensure that people are empowered with the right information for them to make informed decisions. These are new vaccines which became available from early last year, actually late 2020. And therefore, there's a lot of learning that we are getting as we go forward. So the main focus really is to empower people with information and the correct information in terms of what is the vaccine, what are the benefits of the vaccine, why should you as an individual get that particular vaccine, and where should you find this vaccine. And that has been the main message that WHO is partnering with governments to ensure that the population is empowered with that particular kind of information. Yes.
All right. And Dr. Akwale, I think one of the things that we're struggling with as a country is people not completing their vaccines. Someone goes for the first dose and then that's it, right?
Yeah.
So how are we doing and what then needs to be done just to make people understand why it's important for them to complete the doses? And now that we're rolling the boosters as well.
So misunderstanding that vaccines are a treatment. So we have Kenyans who say, it's until I start feeling sick that I go to the vaccine. I think that is something that has to be corrected. Yeah. Vaccines are a prevention, and we always preach prevention is better than cure. So the best thing you can ever do if you have to prevent yourself from infection is to get vaccinated well in advance. As you know, this pandemic is still there. Variants that are being reported, you have now had the BA5. There are surges in other parts of the country. The fact that we've not had a surge here doesn't mean the disease ended. Number two, is the evidence of waning immunity. Immunity from either the vaccines or previous infection wanes over time. It wanes within some weeks or months. On average now, we are looking at 6 months. So after 6 months, your immunity is so low that you are therefore very liable. You could easily come down in case there is a surge. So that's why we did recommend a booster shot after the primary series. The primary series are the 2 doses, so you get the first booster dose. Now again, just a few weeks ago, the Technical Advisory Group recommended a second booster shot. And basically it's because of that scientific evidence of waning immunity. You are prone now to infection, and especially if you have medical conditions then and your immunity is low, then you don't want to become the statistic of those in admission, those in ICU, those requiring, and those unfortunately being counted as fatalities. Especially people who are above 50 years. Those frontline workers, health workers, and others like the security forces, the teachers, the people who really have to do the work, need to go for a booster shot. Absolutely. It is necessary. It's not that we are forcing anybody. It remains voluntary. But you consider yourself that if this infection and another surge comes, and now we are hearing of a subvariant that is highly transmissible, then it better gets you protected.
Absolutely. All right, how about we take a break? But of course, when we come back, we'd want to understand the state of the art mRNA facility, which was to be established in the country. And of course, the aspect of genome sequencing as well. We'll be tackling that after the short break. Stay with us. This is Health Diary. Welcome back. Glad you're still with us. The show is Health Diary, and today we're targeting COVID-19 vaccine. That is why we have Dr. Willie Sakwale, who's the chairman, National COVID-19 Vaccine Task Force, together with Dr. Kibet Sergon, who is an immunization advisor from the WHO, to just help us understand why we all need to get vaccinated. This is against COVID-19. But Dr. Kibet, quickly, right now, of course, in the country, we're experiencing a bit of a cold season. And of course, we understand how cold season comes with flu, and then some of the symptoms for flu mimic those ones with COVID-19. It's a lot of, mix here and there. So is it time that maybe us as a country switch up a little bit in terms of the protocols laid aside as far as COVID-19 handling is concerned, or how different can we see the handling as far as COVID-19 is concerned?
Just to put across that from June, we've noticed an increase in the number of people presenting with respiratory tract infections. And one of the possible ones are usually COVID-19, apart from other diseases like flu and the rest. And it's important also to appreciate that we've noted an increase in the number of people presenting with symptoms that fit COVID, and they've been confirmed to have COVID disease. Yeah. So the positivity rate has moved from 0.1% to now above 10%, suggesting that we've got an increase. But the good news is that we've not witnessed severe forms of disease, meaning that the number of people who are in admission in hospital, those who are in oxygen, or those who are in ICU, are fewer compared to the previous surges that we've had before. So it's also a wake-up call to everybody that please get your vaccination, get protected, be safe all the time by ensuring that you have personal responsibility.
Okay. All right, and Dr. Akwale, again, you mentioned mutations, which again, we've seen this since the onset of COVID-19. So what exactly are we dealing with as a country now? And are the symptoms a little bit different from, the previous mutations of the same?
Yeah, so this country, we've had various variants. We had the Alpha, which was the very initial one that was the major strain. Mm-hmm. And then we went to the Delta that really had a very big impact here, that was responsible for mainly the fourth wave. And then at the end of last year, of course, we got the Omicron, which was highly transmissible. Virtually everybody started coughing, even if those who never went tested, most likely they had Omicron. Now, within Omicron, therefore, you've started now seeing subvariants called 1.21 something, but now there's there's BA5. And this one, what is being said is that the scientists suspect it could be evading immunity. It's not yet confirmed, but that's what they are suspecting. Okay. And that's why a very keen eye has been placed on it. It may not be severe, nothing to worry about now, but remember, this is a disease we keep learning. We just have to appreciate the pandemic is not yet over. And therefore, the need of constant surveillance. If you ask me now, the Omicron is still the dominant variant here, but whether the subvariants have been identified, that is another team that looks at that.
Okay, and then we also talked a little bit about herd immunity. But then, Dr. Kibet, just in case someone is thinking, okay, what exactly are you talking about when you say herd immunity, and what will it take for us to achieve herd immunity, especially in the country?
Herd immunity is the protection that others who have not received vaccines are conferred by virtue that we've got a group of people, and if we're saying the herd immunity, we're looking at 80% or 90%. The understanding is that out of 100 people, if you vaccinate 80, even if the disease is there, those 20 who are not vaccinated will not get the disease. That means the vaccinated persons interrupt the movement of that particular virus or particular pathogen from one person to another one. So that's really the aim. It's about those who are vaccinated, protecting those who are not vaccinated within a community. And you need to have a substantial number of people who are significant to interrupt that particular movement of disease from one person to another one.
Okay, then can we talk about the genome sequencing? And of course, again, this is happening at Kemri in Kilifi, where it sequences up to, 200 samples weekly? But then there's that capacity for 700, right? So then what are we seeing, what are we studying, and what do we need to do to empower them, so that we make maximum use of the same, that is up to 700?
For us to increase the ability of the country to do more genomic sequencing, you need to have people who have the ability to do it. They need also to have the right equipment so that they're able to conduct this. So in essence, going forward, there is need to expand the number of sites who are able to do genomic sequencing and also contribute to the global database on genomic sequencing on the variants that we have for both, all variants for COVID-19, and therefore that's important. So it's something that I would encourage government to invest. This is part of science that contributes significantly also to inform even vaccine development and improvement in the vaccines that we're going to have going forward.
Absolutely. But then just in case someone is watching us and thinking, what do you mean by genomic sequencing, and why is it important, and especially for us as a country to conduct the same?
So it's just to say that you've got a virus, which is SARS-CoV-2 virus, but then you need to break it down further and say, what are the components in it? So it's more of a specialized piece of work that our colleagues in the laboratory do to confirm the details. And that's why when we're talking about variants, it's all because of what has been done by the team who are doing genomic sequencing to identify this is the coding of this particular virus. Is it similar to a previous one in another country, or is it different? And then you'll be able to identify and say, yes, we've got a different variant, which is not what was previously there. So it's used to compare. So you're mapping that particular database of that DNA of, the virus itself, and then from there you share it out.
Okay. And then Dr. Kwale, of course, last year we saw, again, Kenya and Moderna signing an MOU to establish, like we said, the state-of-the-art mRNA facility in Africa. And of course, again, the goal is producing up to 500 million doses, again, of vaccines each year. What is the progress? Where are we? Has it started operations?
What is important about the Moderna investment in Kenya is that it will actually be producing the drug substance. The drug substance for messenger RNA vaccines, which are the vaccines of the future. which can be used not only for COVID, but for other diseases as well. So the importance of that venture that Moderna is placing in Kenya is to produce the drug substance that will be used by Kenyan factories, but also supply the African continent. Following that also, the government has put money to set up a vaccine, human vaccine manufacturing plant. There's very good progress. The renovations have been done in Embakasi. Staff are being recruited as we speak, and plans to have it commissioned in the next few weeks are on. That human vaccine, of course, starting with what you call fill and finish for use, is also going to produce other medical products. The medical infusions that we are importing is part of the mandate. The issues like the snake venom, we are going to look at also medical devices, assistive devices, hearing devices. So its mandate, if you look at the act that established it, is broad. And for me, I think it will be the best legacy from the lessons we've learned from our response to COVID. Because remember, transport came to a standstill. Yeah. Remember, we didn't have vaccines. We couldn't even PPEs before we started manufacturing. So I think the Kenya Biovax, once it really rolls out, we can walk into the future with more confidence as we face future pandemics.
And then again, when it comes to pandemic, nobody wants you, right? That there's going to be a pandemic and this is what you need to, just the same way as COVID-19. But as far as then Africa, Dr. Kibet, of course, there was a lot of questions as far as we do not have enough doses. The Western part of the world is not, donating as much vaccines to us, and Africa does not have enough. So where are we at as a moment, as a continent?
For overall vaccine supply globally, things have stabilized. Yeah. We've got sufficient amount of vaccines available. Africa falls under a category of group of countries called AMC 92 countries, which are supported through a coordinated effort called COVAX, which is pooling resources to ensure that vaccine distribution globally is coordinated and shared out so that all countries are able to access vaccines. Last year, there was global supply constraint, which stabilized towards the end of the year. So far, African region, we've received about 700 million doses of vaccines. They have administered about 380 million of them. And currently, we do not have a major constraint in terms of vaccine supply. I think the major focus now is how do we ensure that all these vaccines are used to protect the population from getting disease. Going forward, I think there's an effort by the African Union to ensure that vaccine manufacturing is an agenda. Yes. And Kenya is one of those countries in the front line to ensure that this is done. So there's good progress within the region. And we do hope that self-sustenance will be an agenda for the future going forward so that we're able to have all these vaccines. But there's a global effort to ensure that there's vaccine equity so that nobody is at a disadvantage even if you're not having adequate amount of money or a manufacturing plant within your country.
And of course, Dr. Akwale, again, as we close, in terms of, because again, other countries, for example, with China, the UK, they sort of reported a surge, and this is after vaccinating a majority of their populations. So us as a country, even as we head, towards the target, that is 27 million people, and just to emphasize the importance of vaccination and the impact that it will have. To what magnitude, will this happen in terms of the impact that vaccinations will have, either on healthcare or just populations in general? Currently,
the vaccine is the best defense against the current pandemic. That has been shown. In fact, there's increasing evidence. If you have a booster, the chances are reduced for severe disease. Double boosted, it's even better. So for us going forward, we want to continue prioritizing vaccination.
Absolutely. Dr. Willis Akwale, Chairman, National COVID-19 Vaccines Task Force, as well as Dr. Kibet Sergon, who is Immunization Advisor, World Health Organization. Gentlemen, thank you for coming by today. And of course, time now for you to take a look at this health tip.
Flexology is a zone therapy where you work on the palms, the feet, the face, and the ears. So the benefits are it helps in distribution of energy throughout the body. It helps with anxiety, helps in improving sleeping patterns, especially for the insomnia patients, increased circulation, and it helps reducing pain.
Well, after all is said and done, individual responsibility is key, and this is as far as the fight against COVID-19 pandemic. Now you know how important it is for all of us to get vaccinated. So that is where we have to say goodbye right here on Health Diary, hoping that you learned a lot from today's conversation. My name is Winnie Lubembe. A special thanks to 4 Points by Sheraton for hosting us. In case you have any more questions, the conversation continues on our social media platforms. And until next time, adios.
Sound check. 1, 2, sound check. 1 check. Sound. 1.
We will be seeing